Dr. Cassie from NABC's Vetfolio and the host of Vet2Vet. Deciding the best course of care for a dog you've diagnosed with lymphoma must include a mountain of considerations, and at the top of that is what's truly best for the patient. Here to help us break down all the ifs, ands, and buts is Dr. Rachel Venable. Dr. Venable is board certified as a medical oncologist from the American College of Veterinary Internal Medicine. She's authored numerous publications and often speaks about her oncology philosophy, a team-based approach where the local veterinarian and pet family work together to provide compassionate, individualized care and optimal quality of life for pets and their families. I love that philosophy. Dr. Venable, thank you so much for joining me today.
Thank you.
So happy to have you here. Lymphoma, I feel like, is one of those, really probably like most oncology cases, it comes with a lot of questions. And, kind of what comes to mind for me initially is, unfortunately, a lot of these patients that we see that are presenting with lymphoma, they're still feeling pretty good. But we do get some patients where we get that little bit of urgency. They're not feeling as good. So in terms of a diagnostic workup and treatment, how would you approach a patient where the presentation kind of walks and talks like lymphoma, but the patient's not feeling good and we're feeling that urgency to intervene sooner than later?
That's a great question, and something that I think we run into all too often, where they come in because the pet's maybe vomiting or not eating or weight loss, and then physical exam, maybe you find big lymph nodes. I'd say that's sort of the classic, like you said, walks in like lymphoma. And as far as diagnostic tests, getting that cytology, so confirming just by aspirating a lymph node, that just really helps because it's nice to have on paper that this is lymphoma. Even though it really looks like it, it's nice to have it confirmed. Also, that cytology can give us a lot of information. We're looking to see the size of the lymphocytes, also just how it looks to the pathologist. So that piece of paper is important. So I would say that's number one. The second thing would be blood work. That tells us a lot too, especially if the pet is sick. Is their calcium really high? That's something we can see with lymphoma. How are the liver, kidneys, all just kind of basic health. So the other thing on blood work that's important too with lymphoma is we want to see, is that lymphocyte count really high? Because if that's high, then that's also worrisome. Is this a more advanced, like a stage 5 lymphoma? Could this even be acute leukemia? So again, I would say those two tests give us the most information and can really help, if you refer to an oncologist, they can really help the oncologist talk to the owner, guide different options. Chest x-rays are also really nice. And so these are all tests you can do in practice. And the chest x-rays are nice because if you do have, let's say, pleural effusion or a big mediastinal mass, again, that makes this dog a more advanced case of lymphoma.
Sure. That's going to paint a much different picture when we're having that conversation with the owner.
Yes, and that's all three of those things, cytology, blood work, x-rays, can do in primary practice. And then the other big thing, like you said, this is a case where the lymphoma is sick. So what do? Because often, you can't get them into an oncologist right away. So one of the main things to do is prednisone. And that is somewhat controversial because we know prednisone might lead to resistance later on if we want to do chemotherapy, or could it interfere with tests with the oncologist? So I often find veterinarians asking questions, can I do this? Should I do this? But I would say if you have a sick dog, if they're just kind of a gray zone, but if they're truly sick, you really need to give them prednisone because they're just going to keep going downhill before they may even be able to make it into an oncologist.
I'm so glad that you brought that up. That's always a big question I have. It's definitely a question I have for this conversation is, yeah, where is that line? When do we start prednisone in a patient who's sick? And that's always kind of been my thought is, if we start it kind of in the beginning there when they're not feeling good, will a couple of doses really, have an impact on the ability for them to get chemotherapy with an oncologist? So I love that you bring that up where, if they're really kind of spiraling and sick and not doing well, you probably need to go ahead and start that. Otherwise, they're just going to keep going downhill before we can get them treated.
Exactly. That's right. So prednisone, really a lot of dogs, not everybody, but a lot of them can really respond. Not just their lymphoma, but sometimes just increasing that appetite, helping with their energy, all those things can really help. And as far as resistance, so there's a lot of question marks with this. In studies, we have found that giving pred by itself can upregulate the P glycoprotein pump on some of the cells in the body that can then go on to pump out our chemo too fast. So that's where that chemo resistance phenomenon happens. When does that happen? That's where there's still a lot of question. I would say, nobody really knows. We usually say after a couple weeks, I would say definitely by a month, which hopefully in that kind of time frame, they're able to get into an oncologist or decide if they want to do chemotherapy. But I think it's a conversation to have with the owner. If you have a dog that maybe you don't have all the test results back, but you're pretty sure is lymphoma. They're sick, so you want to start them on prednisone. It's just important to let the owner know, there's a little bit of a time clock that starts when we put them on this drug. So while you're waiting to get things, or maybe you already have the results, and the owner just needs to know they need to make a decision if they want to treat or not in the next few days, or hopefully getting them into an oncologist. Most oncologists will hold some emergency slots for like lymphomas or acute leukemias, because we all know they can't wait a month, like maybe a solid tumor could.
Sure. And just for my own curiosity, when we're talking about starting prednisone, it makes sense that, if we have this dog that's sick and we have a high suspicion, we can go ahead and pull our cytology sample and, kind of wait on that. But if we did want to pursue some additional diagnostics like flow cytometry or something like that, how would we approach that in a sick lymphoma patient? How would that prednisone affect our ability to get those diagnostics?
Yeah, that's a great question, because it could affect the diagnostics. That's something as an oncologist, sometimes I see, because the dog will be started on pred. And then when it comes to see me, the lymph nodes are a lot smaller, and that can, well, that's good for the dog. It can interfere with test results later. And what the flow cytometry can tell us is it can tell us B cell versus T cell lymphoma, which can help guide prognosis as well as treatment recommendations. And then there's some other prognostic markers that we've started evaluating on flow cytometry too. So it just gives us a lot more information. PAR is something that you can do on slides that you already sent into the lab. So I usually just get a lot of questions on what's the difference between these two, because a lot of times the pathologist will mention both. So PAR is something that you could just add on later. It's not as good to tell B versus T cell. It's more of a test to confirm lymphoma, because it looks at clonality. Flow cytometry, this is really a test. Ideally, you submit if you know if it's lymphoma, but let's say, you have that sick case like we we're talking about. So if the lymph nodes are enlarged, you're submitting for cytology. And then to submit for flow, it's actually really easy. You can either order the media from the lab, or you can make it yourself. And to make it yourself, it's quite simple. It's just 1 ml of saline and 0.1 ml of serum. And a lot of times you can just get it from that same dog, or if you have other like healthy dogs in the clinic, you just need a tiny bit of serum. So you just put that into an empty tube. You don't want any other additives in there. And then you just aspirate the lymph nodes. So kind of like you do for cytology. The only difference with flow is we want more cells. So we actually want to see chunks. I know that sounds sort of gross, but when you're aspirating the lymph nodes, I'll actually use suction, which we don't typically do for cytology because you'll break the cells. But in flow, it doesn't matter so much. It's more about a number, right? So you're kind of getting almost a biopsy in a sense, because you actually see some of those cells. So I'll usually aspirate at least 2 lymph nodes, or at least 1 lymph node more than one. So you want to put a couple samples in a tube. And my rule of thumb is if you hold that tube up to the light and you see chunks, literally floaties in there, then you should have enough to submit your sample. And these do need to be overnighted. It's something where these cells, they have to be alive when you send it to the lab. So usually it's FedEx or UPS, one of those services that can get it to a lab quickly.
Absolutely. And I think I've heard talk about we can go ahead and submit that flow with our cytology. And if our cytology, if it's not lymphoma, which most of the time these are walking and talking like lymphoma, but if it's not, then they just won't run that sample. So we could maybe even like pull it at the time and then start prednisone if we had a really sick patient.
Exactly. Yes. You can always cancel the test. Sometimes it could still help. Like if the cytology is coming back a little wishy-washy where they're not quite sure flow may still be helpful, but let's say it comes back completely not lymphoma, then yeah, you can always cancel that test.
Well, perfect. I'm glad that we went over all of that because those are all questions in my head when I'm presented with these patients, especially if they're not feeling good. What medications can I start safely and what diagnostics do I need first and on and on. So that was very, very helpful. I'm curious to know how your approach would differ in a sick versus a healthy patient who presents with lymphoma. The owner says, yes, I absolutely want to refer, but they need, say, a bridge to oncology. Like you said, hopefully they can get into one of those emergency spots if this is a sick patient, or we can get them in before they start feeling bad if it's a healthy patient. But they just need something to kind of bridge that gap before we can actually get them in with an oncologist.
That's another good question because, unfortunately, there's just not enough oncologists out there. And so, because of that, wait times can be long. As I mentioned, for lymphoma, especially sick ones, most oncologists will hold emergency slots, but those can fill up too. I mean, it's one of those. It's always tough, but at the end of the day, you're just a person, and you can only see so much. But what's interesting for those, more or less healthy lymphomas, an interesting drug that's come out is Laverdia CA1 verdinexor tablets. This is something that we can actually use to treat lymphoma, but it doesn't cause that same drug resistance like we can see with prednisone.
Yes, and it's important to note here that conditionally approved animal drugs are limited to a specific use. In this case, of course, canine lymphoma. Based on the FDA CVM's assessment that Laverdia CA1 or verdinexor tablets demonstrated to be safe when used according to the label, reasonable expectations of effectiveness for the treatment of canine lymphoma, and that the drug is manufactured in accordance with full approval standards.
And the fact that these are pills, you can actually safely give this in general practice. So, IV chemotherapy, you have to have a lot of special equipment, how you're giving the drugs, a chemo hood, all those things. But when you're dealing with pills, really all you need is gloves. And so, this is something that I think family veterinarians, you guys could feel comfortable giving these drugs.
Yeah, I think we would feel comfortable prescribing that to owners, especially, since we're talking about pills, like you said. But of course, some important points we would always want to make sure and cover with owners that they should wear protective, disposable chemotherapy resistant gloves when they're handling Laverdia CA1 and avoid direct exposure to moistened, broken, or crushed tablets or biological waste from the treated dog, like feces, urine, saliva, vomit. Always make sure they're washing hands before and after handling the tablet. Keep it out of reach of children. Return that empty bottle to the veterinarian so we can dispose of it properly. And of course, it can't be overstated. Pet owners should absolutely be wearing gloves when they're handling their dog's bodily waste or fluids.
And it's something where if you have a lymphoma dog that wants to see an oncologist, but there's going to be a wait, you can start them on this drug and it's not going to make them resistant to other chemo later. The oncologist could still start them on other drugs like CHOP or that kind of thing. So they could even stop the Laverdia CA1 or continue it if the owner doesn't want to do IV chemo. So it's a nice drug that can help the dog so they don't get sick by the time they see the oncologist.
That would be a huge relief because I think that's one of our big concerns in these healthy lymphoma patients is, can I get them in before they start to go downhill, before they start to get sick? Because I think you made a great point earlier when you said you're only one person. You can only see so many cases, and there's a lot out there to be seen. So to have something where, we're not in this race against time, maybe with prednisone or something like that, and we can bridge that gap and buy ourselves a little bit of time. I mean, that takes a lot of pressure off.
No, that's awesome. Yes. And it's something that I think a lot of oncologists were excited about because it also helps to take that pressure off. Because, yes, once that dog comes in and they're sick, then prognosis can shift. Sometimes chemo can be a little bit harder on them. And so it's ideal if they're feeling, reasonably well. They don't have to be 100% normal, but as long as they're feeling pretty good. So it is exciting that we have this drug to offer in those situations.
I'm wondering what would change in a patient where we diagnose this lymphoma and they have an owner who says, I'm willing to pursue oral therapy, like you're talking about, things that we can prescribe as general practitioners, so Laverdia, prednisone, things like that. And they really don't want to pursue referral or any chemotherapy beyond that.
Yeah, and I think that's a situation that you guys probably run into a lot. I've heard different statistics, but from what I understand, there's not that many pets that actually make it to the oncologist. And so I think you guys end up diagnosing and seeing a lot of dogs that I never see. And so I think it is nice to have something more than just prednisone that you can feel comfortable prescribing and also safe in your practice. And I think, Laverdia CA1, because it's pills, as I mentioned, you need gloves, and it is important to talk to the owner about safe handling. Again, they should wear gloves when handling the drug. And, you know, um, I always talk about storage is important. And some of this stuff I feel like on some level is a bit of common sense. Don't touch the drug and touch your face, or, obviously you don't want to take it on accident. Every now and then we've all had clients that have taken their dog's meds, I think, at some point in
Oh,
our
yes.
career. So this is a pill that you really want to make sure that mix-up doesn't happen. Um, but I think this would be a nice choice. It's something where we've seen with this drug. So the original studies with Laverdia CA1, they found that quite a few of the dogs responded. If we looked at clinical benefit, so that means dogs who lymph nodes either shrinked or they stayed stable in size, that clinical benefit was over 50%. And so when we're talking about a more palliative scenario, which I would say we're in if we're not pursuing more of the IV chemo, we're trying to give more time, but the reality is even with IV chemo, we're not looking at a cure. And so I think often if we can keep their quality of life good, if we can keep the disease from progressing, for as long as we can, that really is a win for these dogs.
Is there any data on, kind of long term? Am I hearing you correctly that, if we put them on Laverdia CA1 and they don't want to, the owners don't want to pursue additional referral in IV chemotherapy, that as long as we're seeing that clinical benefit and we're maintaining quality of life in our patients, we can keep them on that drug?
Yes, that's how I would treat this one. So you want to make sure that the lymph nodes aren't growing. So, I would measure them. That's what, I'm a numbers person and a little bit type A. So I really measure everything. But I'd say practice, you ideally you would be measuring the lymph nodes, make sure they're not growing. Because if they're growing, then we worry, okay, this isn't doing enough. But if things are staying stable to improve, then I would keep them on the drug. The other big thing to watch is quality of life, making sure we're not seeing side effects. Some things with Laverdia that we could see, some dogs, stomach upset, which we can see with a lot of different oral targeted type therapies like Laverdia CA1. The other one is lethargy. So just keeping an eye, also checking blood work. So generally I recommend rechecking these guys about once a month for exam and blood work, just to make sure, they're responding and that they're tolerating the medication well. And in that main study that they've done, most dogs responded to Laverdia CA1 for 2 to 3 months. And again, one thing to keep in mind is response is different than survival time. So most of our chemo studies, especially with lymphoma, and a lot of the earlier studies, they all looked at survival time. And so that actually includes beyond that original treatment. So it does make things a little bit confusing when you're trying to compare results. So with Laverdia, I think something to keep in mind is most dogs, they responded to it for 2 to 3 months or more. And then, you could, if they start to progress, then you can look at other treatment options. But it's different than that survival data, which is what we have for like the CHOP protocol and some of the single agent drugs.
Sure, sure. That makes sense. And so if I can try to recap what I think I'm hearing, and feel free to tell me, no, Cassie, you got that completely wrong. Hopefully that's not the case. It sounds like when we're presented with these sick lymphoma patients, we really need to go ahead and start them on prednisone because they're just going to keep spiraling if we don't. Whereas if we have a healthy lymphoma patient who's overall feeling pretty good, we can use Laverdia CA1 to kind of bridge the gap to get them into an oncologist. Or if the owner doesn't want to pursue referral, doesn't want to pursue IV chemotherapy, we can maintain them on Laverdia CA1 as long as we have that response and that good quality of life.
Exactly. No, you got it perfectly correct. You're still a great student.
Yes, tell me more. Build up my ego a little. Just kidding. Well, that's really helpful because these are all questions that swirl around in my head of, how do I give the owner the best information. And there are so many variables that can happen around lymphoma. So that really helps break it down into, okay, here's a starting point for these kind of three categories that you might be looking at.
Exactly. Exactly. Yeah, the lymphoma talk, it can become really long, and I feel like it's hard for you guys in general practice because you don't want to sugarcoat it, but you don't want to say something wrong either. So it can be tough. I definitely don't envy you guys, just like I wouldn't want to have to talk about certain surgeries or diabetes, things I don't deal with either. So I think it's important to know if you see a lymphoma in front of you, just letting owners know this is really aggressive. There's treatments we can do that could help them to live longer. Most dogs do a lot better with therapy than people. And then, kind of feeling out if they want to see an oncologist, because the oncologist should really answer those more nuanced, detailed questions as far as what drugs, what's the big picture with this. If you have an owner that's really drilling you, trying to get all that info, you can certainly reach out to an oncologist and they can help you, but I do feel like it's important to give them as much as you can, but I also understand it can be a tough position for you guys.
Yes, but like I said, I think that gives us a really great starting point of at least kind of how to think about these from a diagnostic standpoint and from that initial treatment standpoint, and how to talk to owners about those things. The other thing that I always struggle about with owners when it comes to lymphoma and is a huge part of that initial communication is, of course, these pet owners want to know about prognosis. They want to know how is this going to go? And kind of like we've touched on here, there's a lot of variables that go into, survival versus response and things like that. So can you give us some pointers for how to talk to owners about prognosis?
Yeah, I think if you have that owner that really needs more detail, especially before seeing an oncologist, then I think a couple things. One, ideally, you've done some of that other testing. So, like the blood work. So, we know because if there's a really high lymphocyte count in the blood, that's going to change the conversation. Or if there's fluid in the chest cavity, that's going to change the conversation. So, ideally, have some of that workup or knowledge. And then, I think it's probably fair to tell owners that it is cancer. I feel like so many people, they just need to know that. Like, you'd be surprised how many people come to the oncologist and say, so you really think this is cancer? Like, you'd be amazed how many times I get asked that. But so just confirming with them, yes, this is cancer. I would say that it's not curable, especially if we know it's our large cell, high grade lymphoblastic, kind of that classic lymphoma. It's not generally something we cure, but there's a lot of treatment. So if dogs, if they do multi-drug protocols, often we could be looking at a year survival time or so. So if you have an owner that's really digging, which I could understand if they want a better idea before they see an oncologist. So I say, generally speaking, we could see about a year or so survival, depending on response. And I always tell people that that's on a curve, that it's not an absolute. I feel like, especially when it comes to cancer, people get really focused on numbers. So just kind of reminding them that this is all averages. Dogs that have more aggressive disease, so like if it's in the blood or T cell, they maybe wouldn't respond quite as well. There are single agent chemo drugs that we can do, which are generally less expensive, less time intense, but they usually don't work quite as well. It's about half the response time, generally speaking, depending on what's going on. And then things like prednisone. So classically, if we do prednisone, usually what we find is survival time is about a month or two. And I've had kind of some pushback over the years from different vets. And I'll be honest, I've seen some cases that have done better than that. And I've seen some that didn't do that well. But a large study really looking at dogs with lymphoma where the owners only pursued prednisone found the average survival time was 50 days. And so I think that's still very fair to tell people, if we do prednisone, more palliative care, we're looking at a month or two.
Sure. And I would say, same as you, I've seen cases go longer and shorter than that, but that I feel like pretty well reflects what I've seen with prednisone alone.
Yeah, and I think too, if you have people that want to do pred alone, it's important to, really have that quality of life talk, you know. So talking about things like keeping track of good and bad days can be really important for people. Making a list of things that the animal always like to do. And I always tell them, can make it pretty detailed, like playing with certain toys or going for walks or barking at the delivery guy. I don't know, but just different things that they can really cross off that list. Because with lymphoma, often what we see is the dog will truck along and maybe the lymph nodes start to get big, but they're still feeling pretty good. But I find often they start to hit a wall. And so I think it's really hard for pet owners because they're like, how can my dog be sick? They're acting so normal. But then when they hit that wall, things start to change fairly quickly. So I think having a list, keeping track of things really helps them gauge, where are we on quality of life? And then certainly things to monitor, if we're worried about them suffering. So like if they're not eating, if they have like really severe stomach upset, and some of that stuff we can help with medications, appetite stimulants, anti-nausea, anti-diarrhea meds and things. And they usually can work for a little bit, but at some point nothing works, right? And the dog has no energy, no appetite. And then eventually with most lymphoma dogs, they start to have trouble breathing is what often we run into, if they're succumbing to things naturally.
Yes. And those cases are just heartbreaking. But I think you bring up such an important point that when we're talking to owners about prognosis, to make sure that they're aware of what that declining quality of life looks like. And so hopefully we can intervene before we've just, lost all quality of life and this poor creature is suffering.
Exactly. So yeah, so I think it really is an important conversation. It's hard. Nobody wants to talk about that. And the owner may not be able to hear it that first time. But when,
Sure.
when they come back or if they call, I think it is important to then kind of talk about, we need to look at quality of life and this is what the disease can look like over time.
Absolutely. Absolutely. I think those are all great points. And Dr. Venable, thank you so much for joining me and having this talk. It was hugely helpful. I feel like you painted some really clear pictures in my mind of how to approach these cases when we're presented with them. So thank you so much.
Thank you for having me. This has been a great chat.
And thank you to DECRA for partnering with us for this edition of Vet2Vet. Check out NAVC's vetfolio.com for more of our V2V discussions on various topics in veterinary medicine. And remember, if one animal is better off because of you today, it's a great day. Important safety information. For use in dogs only, Laverdia CA1 Vertinexor tablets is conditionally approved for the treatment of lymphoma in dogs, not for use in humans. Keep this and all medications out of the reach of children. Children should not come into contact with Laverdia CA1. Pregnant women, women who may become pregnant, nursing women, and children should not handle or administer Laverdia CA1 or come into contact with the feces, urine, saliva, or vomit of treated dogs for 3 days following treatment. Laverdia CA1 can affect male fertility based on animal studies and studies in humans. Wear protective, disposable, chemotherapy-resistant gloves when handling Laverdia CA1 to avoid direct exposure to moistened, broken, or crushed tablets or biological waste from the treated dog, feces, urine, saliva, or vomit. Do not use in dogs that are pregnant, lactating, or intended for breeding. Laverdia CA1 is a possible teratogen and can affect female and male fertility. Dogs should be frequently monitored for hematologic and serum chemistry abnormalities. The most commonly reported adverse reactions in dogs include anorexia, weight loss, vomiting, diarrhea, lethargy, polyuria, polydipsia, elevated liver enzymes, and thrombocytopenia. Please see package insert or visit decra-us.com for full prescribing information.